Assalamu alaikum wa rahmatullah. Hello everybody, I'm Dr. Imad Ibrahim. We'll continue our ACLS pre-course work. Today we'll start lesson 3, systematic approach. Let us see the video and solve the 4 questions.
Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use personal protective equipment, such as gloves. The American Heart Association systematic approach includes 3 components once you have established scene safety and your initial impression of the patient: the BLS assessment, the primary assessment, and the secondary assessment. These sequences combine assessment and treatment components for effective resuscitation. When deciding which assessment to use for a patient, start with a step we all do automatically. Visually assess if the patient is conscious or unconscious. This is your initial impression of the patient. You can form a rapid general impression by a quick visual assessment of responsiveness, breathing, and color to determine the urgency of the situation. After determining that the scene is safe, if the patient appears unconscious, use the BLS assessment. After completing all of the appropriate steps of the BLS assessment, progress to the primary assessment for more advanced assessment and treatment. Finally, progress to the secondary assessment. If the patient is conscious, go directly to the primary assessment and then the secondary assessment, which we'll review in a moment. For unconscious patients, you'll follow the BLS assessment. First, check for responsiveness. Tap and shout.
Are you okay?
If the patient is unresponsive, shout for help.
He's unresponsive, I need help?
Activate the emergency response system and get an AED or defibrillator. Depending on the circumstances, EMS providers may need to call for additional responders to assist with the patient. In some settings, the healthcare provider may assess the patient's breathing and pulse before activating the emergency response system. Next, check breathing. Scan the chest to detect if breathing is absent or abnormal. Check for pulse. Ideally, you should check breathing and pulse simultaneously. If you can't feel a pulse within 10 seconds, start high-quality CPR, beginning with compressions. If you determine the patient is not breathing normally but definitely has a pulse, bypass chest compressions and support the patient by ventilating once every 6 seconds. As soon as possible, attach an AED or defibrillator and, if indicated, deliver a shock. High-quality BLS is the foundation for saving lives after cardiac arrest. If these steps are performed rapidly and well, the patient's chance of survival increases. In fact, the effectiveness of advanced life support measures depends on high-quality BLS. In some cases, BLS will result in ROSC, but sometimes cardiac arrest persists, requiring you to continue with more advanced invasive measures. This is when you should follow the primary assessment and secondary assessment. Another time to use the primary and secondary assessments is if a patient is conscious. You can easily remember the steps of the primary assessment by thinking A, B, C, D, E. Keep in mind that although these steps are listed in progressive order, the resuscitation team often performs them simultaneously. A stands for airway. For unconscious patients, healthcare providers should maintain a patent airway and consider inserting an advanced airway device. Regardless of the device chosen, the resuscitation team must ensure proper placement and use waveform capnography to monitor effectiveness. Conscious patients can often maintain the integrity of their own airway, and healthcare providers need only ensure patency by providing suctioning if needed. B represents breathing. If the patient is not in cardiac arrest, healthcare providers should assist ventilation as needed once every 6 seconds. If the patient does not require assisted ventilation, healthcare providers can support the patient by administering oxygen as needed. C involves supporting the patient's circulation. Attach ECG leads, obtain intravenous or IV access, or intraosseous or IO access. Give appropriate drugs to manage abnormal rhythms, and assess for perfusion issues. You are collecting a wide range of information, including blood pressure, heart rate, and cardiac rhythm. Additional data, such as temperature and glucose levels, may further refine the initial interventions needed. The A, B, and C steps provide a continuous stream of information about the progression of the patient's condition. D stands for disability. This involves checking for neurological function, quickly assess for responsiveness, levels of consciousness, and pupil dilation. A quick tool that can be used to evaluate neurological status is AVPU: alert, voice, painful, and unresponsive. Finally, E involves exposing the patient. Remove clothing to perform a physical examination, looking for obvious signs of trauma, bleeding, burns, unusual markings, or medical alert bracelets. The secondary assessment involves the differential diagnosis. This involves obtaining a focused medical history and searching for and treating reversible causes. You may naturally jump to some possible diagnoses as soon as you evaluate the patient. However, before arriving at a definitive diagnosis, you'll need to assess the patient and gather additional information about the condition. Gathering a focused history of the patient is recommended. Ask specific questions related to the patient's presentation. Consider using the memory aid sample, signs and symptoms, allergies, medications, including the last dose taken, past medical history, especially relating to the current illness, last meal consumed, and events, especially ones that may have led up to the current illness. The answers to these questions can help you quickly rule in or rule out suspected diagnoses. Next, look for and treat the underlying cause by considering the H's and T's to ensure you are not overlooking a dangerous or likely possibility. The H's and T's create a roadmap for possible diagnoses and interventions for your patient. Let's review these now. Hypovolemia is low blood volume. Hypoxia occurs when inadequate oxygen is reaching the body's tissues. Hydrogen ion or acidosis is the accumulation of acid and hydrogen ions in the blood and body tissues. Hyperkalemia is an abnormally high concentration of potassium ions in the blood. Hypokalemia is low blood potassium. Hypothermia is when the body temperature drops below 95 degrees Fahrenheit or 35 degrees Celsius. Tension pneumothorax results from an abnormal accumulation of air in the pleural space. Cardiac tamponade is a condition caused by an accumulation of fluid between the heart and the pericardium. Toxins may be best uncovered by a focused history. A pulmonary thrombosis or pulmonary embolism is a blood clot from a large vein that breaks off and travels to the pulmonary artery where it becomes lodged. A coronary thrombosis is a blood clot that forms within a blood vessel of the coronary system. Intervening and stopping a patient's downward spiral is the ultimate goal of the BLS, primary, and secondary assessments. The American Heart Association has developed a truly systematic approach that can facilitate optimal care. By following the assessments in tandem with an adherence to the chain of survival, you will more efficiently and effectively assess, diagnose, and treat your patients.
يلا نشوف الأسئلة. الكلام كلام جميل. تكلم عن إنه أول حاجة الأسسمنت في BLS أسسمنت اللي هو العيان اللي أنت ما تجي بتعمل شاوت بتكوري كليه وبتدقه ار يو رايت لقيته ما واعي بتشوف في بلس. في أول حاجة بتأمن السين يعني حتى ما تكون خطر عليك. أما انتهى كورفول هيرب كوريك يا جماعة الشخص ده مثلا ما بيستجيب، أضربه لل 911 وطوالي بتشوف في بلس وفي تنفس. الموضوع ده المفروض ياخد منك 10 ثواني، طوالي تبدا CPR. ده البي ال اس اسسمنت. لا استجاب والعيان واعي، ممكن تمشي من البرايمري اسسمنت والسكندري اسسمنت. البرايمري اسسمنت اللي هو الاي بي سي دي اي، اير واي والبريسن والتمبريتشر، اير واي بريسن سيركيوليشن ديسابيليتي اكسبوجر، الكلام ده. بعد ذاك تمشي للسكندري اللي هو مور، انت بتعمل يكون عملت انفستيجيشن لو في هايبوكاليميا، لو في حاجه، لو في. طيب البي ال اس طبعا هيكون في لو سيشن براو، والتيز والاتش فيري امبورتنت الناس تكون عارفه، لانه دي ريفرسبل كوزز. يعني هايبوكسيا مثلا لو ده اكسجين العيان ممكن يرجع. هايبوفوليميا بتدي دريبات مثلا اي في فلويدز. فهنا عندنا البي ال اس اسسمنت. ده العيان القلب واقف، ده CPR، ده بي ال اس بيزك لايف سبورت. الاي سي ال اس هو البرايم، في غير البي ال اس هو البرايمري سيرفي والسكندري سيرفي. وهنشوف الاسئله بتاعتنا. نعمل نيكست هنا في طيب قال what is advantage of systematic approach to patient assessment? Permit assessment modification based on patient symptoms, standardized treatment across system of care, reduce chance of missing important signs and symptoms, permit more rapid of life threatening problem. اللي هو what is the advantage of systematic approach. السيستماتيك approach طبعا يخلوك reduce the chance of missing important signs and symptoms أو standardized treatment across system of care, permit assessment modification based on patient symptoms, or permit more rapid assessment of life threatening problem. systematic approach طبعا هيكون correct انك انت تروديوس the chance of missing important. ما انت لو ما ماشي بسيستم بتشيك ليست A B C D E يعني بليسته، انت you will miss السيركيوليشن miss كده. فهم ده كلهم قريبات من بعض، يمكن كلهم يكونوا صحيحات، لكن actually systematic approach هم عملوه عشان reduce الميسنج. يعني انت تكون مما تجي مثلا تعمل كده 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 في خطوه انت ممكن تنساها، هي مهمه، لكن السيستماتيك ابروش بيخليك تتذكرها. طيب نمشي للبعديه. What is the first step in the systematic approach to patient assessment? هل initial impression، PLS assessment، primary assessment، secondary assessment؟ طبعا الاول تبدا انت بالبي ال اس والبرايمري والسكندري، لكن اول حاجه الانيشال امبريشن بتاعك انه العيان ده شنو، واقع دايخ ممكن يكون فاقد الوعي. فانا اعتقد انه الانيشال امبريشن. طيب الامبريشن بتاعك عن العيان، يعني احساسك انه العيان ده، لانه ما يزول انت بتيجي جارع عليه، لكن زول مثلا واقع وهناي، ده الامبريشن بتاعك انه هو في حاله خطر. طيب الكويستشن نمبر 3 which action is a part of secondary assessment of a conscious patient? Formulate a differential diagnosis, attach monitor defibrillator, determine patient level of consciousness, give IV fluid. طبعا IV fluid ممكن تكون تبع البرايمري assessment. determine level of consciousness برضو هنا اتاش الديفيبريليتر دي بتاعت البي ال اس، لانه عيان اصلا قلبه واقف. formulate differential diagnosis دي السكندري diagnosis، السكندري assessment اصلا معموله لانك تصل لديفرنشال diagnosis بتاع العيان. طيب نشوف الكويستشن الأخير. which one of the H and T that represent potentially reversible cause of cardiac arrest and other emergency cardiopulmonary condition؟ هل تاكيكارديا هي ممكن تكون cause of cardiac arrest؟ هايبوغلايسيميا ممكن تكون cause of cardiac arrest؟ هل تروما؟ هل هايبوثيرميا؟ which one of the H and T that represent a potential reversible cause of cardiac arrest and other emergency cardiopulmonary؟ طبعا التروما is not، التروما نستبعدها، التاكيكارديا نستبعدها. نجي للهايبوثيرميا والهايبوغلايسيميا. الاثنين هم لو كانوا شديدات ممكن يكونوا سبب للأرست. لكن أنا بعتقد إنه الهايبوغلايسيميا is more dangerous و more reversible. طيب أنا الهايبوثيرميا، لكن also hypoglycemia is احنا طبعا الهايبوثيرميا هنا ما عندنا كتير، لأنه يعني الجو ما بارد، ما أيام بتلقى درجته منخفضة، لكن هم عندهم كتير. فبرضو الزول براعي للحاجة اللي هو في البيئة بتاعته. نحن هنا عندنا زول دايخ ده فاقد الوعي، انت أول حاجة بتخط الهايبوغلايسيميا، هم هناك ممكن يخطوا الهايبوثيرميا كويس، لأنه الجو بارد وممكن العيان يكون فقد حرارة فحصل له النهي. فذيس از الكويستشنز. وإن شاء الله السيشن الجاي هنبدأ السي بي ار كوتش، ونتكلم كيف السي بي ار بتقسم، وكيف انه في كوتش للسي بي ار بيقسم الادوار بين التيم عشان يكونوا افكتيف. زي ما قلنا التيم ده بيكونوا كلهم في الاخير في المجال الطبي، ايزر سيسترز اور نيرسز اور اي واحد من المجال الطبي، دكتورز او نيرس يعني، ودكتورز في الغالب دكتورز او نيرس. Thank you very much for your listening.